Have you ever heard someone say, older men shouldn't masturbate anymore? That it's bad, shameful, or simply no longer necessary at your age. And then one day, you suddenly realize you don't feel like yourself anymore. The emotions that once made you feel like a man, they've faded. I used to think it was sinful, until I started to feel like I was no longer myself. So, what really happens if you stop masturbating after 60? Will your body feel stronger? Or is something inside you slowly fading away? This video will give you an honest look, based on real advice from experienced urologists, and stories few men ever speak aloud. I'm not here to tell you to keep going or to stop, but you deserve to know what's really happening inside your body. Real benefits of stopping masturbation after 60. First, let's talk about the benefits of stopping masturbation. But this only truly applies to men who have become overly dependent on it, or when masturbation has turned into a mindless daily habit. Because anything repeated too often without real emotion or connection eventually becomes a burden to both the body and the mind. And after 60, masturbation becomes even more sensitive. Not just because your body changes, but because your emotions change too. The first benefit of quitting is that your brain becomes less dependent on dopamine. Dopamine is the chemical that brings you pleasure during sexual stimulation. But when overused, the body begins to crave more just to feel the same. Eventually, nothing feels good anymore. You masturbate but feel no satisfaction. You watch stimulating content but feel numb. You feel empty. When you stop, even just for a few days, your nervous system begins to rebalance. Your brain is no longer driven by instant urges. You can concentrate better, feel less tired, sleep deeper, and most importantly, your mind begins to clear like stepping out of a mental fog. Masturbating after 60 is not wrong. But if you're doing it just out of habit, loneliness, or emotional escape, it might be taking more from you than you realize. The second benefit is something few men talk about. Your sexual sensitivity starts to return. Many men over 60 report losing sensation in their genitals. Stimulation feels dull. Some even need extreme content just to feel anything. Why? Because the body gets used to fast, intense stimulation. Used to climax without emotional connection. Over time, your nervous system loses subtlety. But when you stop, or even reduce the frequency, the nervous system begins to reawaken. Sensation returns. Gentle touch becomes meaningful again. You no longer depend on imagery. You begin to feel yourself. Many urologists call this resensitization, a kind of healing only those who have lost connection with their body can understand. Now to the third benefit, perhaps the most important one, the restoration of natural testosterone. After 60, testosterone levels naturally decline. But frequent masturbation, especially when the body is tired or lacking recovery, can cause hormone fluctuations, or even further drops. Some studies show that short-term abstinence can slightly raise testosterone. More importantly, it helps reset your biological rhythm. You sleep better. Wake up more energized. Your mood improves. You feel more stable, less irritable. And that's when you feel yourself again. I stopped. And the first thing I noticed was that I could feel myself again. Not everyone needs to stop masturbating completely. But sometimes taking a short break, a few days, a few weeks, can be a chance to recover and renew. It's like running without ever looking back. Then one day you stop and realize you've lost your way. Stopping doesn't mean giving up. It's how you realign and return to what matters. For men over 60, elderly wisdom is not about denying your needs. It's about knowing what's too much, what's enough, and when it's time to pause and listen inward. Urologist advice never says masturbation is bad. In fact, many doctors recommend it to maintain blood flow and sexual reflexes. But if you feel tired, empty, or drained after doing it, that's your body telling you to stop. Not forever, but to return home to yourself. Silent risks of completely stopping masturbation. Not every man should quit masturbation entirely after 60. In fact, for some, stopping too suddenly and completely can lead to quiet but serious consequences. The first risk comes from reduced blood flow to the genital area. The penis is made of soft muscle tissue. And like any muscle, if it's not used or supplied with regular blood flow, it will slowly weaken. Think of an arm left unmoved for weeks. Muscle begins to shrink. For the penis, the mild result is losing natural erections. The more serious result is long-term erectile dysfunction. When there's no physical or emotional stimulation for a long time, the body begins to forget its sexual reflexes. Blood stops flowing to the erectile tissues. Small blood vessels lose elasticity. The nervous system stops responding to light arousal. And over time you feel as if your body is slowly shutting down. It wasn't that I stopped. It was that I abandoned a part of my body, and it slowly began to die. Some urologists recommend that if you're not having regular sexual activity, gentle masturbation, once or twice a week, can help maintain natural sexual reflexes. Keeps the nerves active, keeps blood circulating, keeps the brain connected to the body. Stopping entirely, unless for medical reasons, isn't always helpful. The second risk is more hidden: your mental health. At an older age, when children have grown and emotional life quiets down, many men find that masturbation is a natural way to soothe loneliness. It's not addiction, if done in moderation. It's a private way of staying connected to your own emotions, body, and sense of self. Stopping suddenly, without anything to replace it, can create a gap. A feeling of emptiness, like you've lost a part of yourself, but don't quite know why. And if you don't understand that feeling, it can turn into low-grade depression. You lose inspiration. You lose the feeling of being alive, especially if you've been living alone for years. So instead of thinking, stopping is right, continuing is wrong, understand that the more important thing is how you relate to yourself when doing it. Are you masturbating to escape? Or are you doing it as a way to stay in touch with your body and your life force? Senior health is not just about blood pressure, heart disease, or diabetes. It's also about penis health, about hormones, and about maintaining that deep inner sense of dignity and identity, even when you're 60, 70, or beyond. Sexual health over 60 doesn't always start with desire. It starts with self-awareness, knowing when to stop and rest, and knowing when to continue, so you don't lose your reflexes, your emotions, or your self-worth. What's the right way? Urologist advice for men over 60. After all the benefits and risks we've discussed, the question many men still ask is, so, should I stop completely or not? According to most urologists, the answer isn't about quitting or continuing. It's about adjusting the frequency and changing the attitude behind the act. 1. Don't stop. Adjust your frequency. Based on urologist advice, for men over 60 who don't have regular sexual activity, masturbating 1 to 2 times per week is considered safe and even beneficial. Each time you do it, your nervous system is reactivated. Blood circulates through the pelvic area. Erectile reflexes stay alive, naturally without medication. This is especially important for men who live alone and have little or no physical intimacy, yet still want to hold on to their manhood. At this age, reducing frequency isn't a sign of weakness. It's a sign of wisdom. Your body needs more time to rest between cycles. And when you listen to yourself, you'll know when to pause and when to continue. Not as an escape, but as a form of health maintenance. 2. Choose the right time, morning. The timing of your self-pleasure can change everything. How it feels and how your body reacts afterward. Morning time, especially within the first hour after waking, is when your testosterone levels are naturally highest. This is also when reflexes are strongest, like morning erections. If you choose this time, you'll likely feel more natural. You won't need strong visual stimulation. Just your presence. Just your breath. Masturbating in the morning sets a relaxed tone for the day. It reduces stress and can improve energy levels. But doing it late at night, when your body is tired and your mood is low, can lead to emptiness, restlessness, or insomnia. 3. Keep the emotional connection, don't just stimulate the body. One of the biggest mistakes after 60 is turning masturbation into a purely physical act. Just stimulation. Then it's over. No emotion. No awareness. No connection. Senior men's health isn't just about blood pressure or cholesterol. It's also about emotional clarity, meaning, connection between the body, the mind, and the soul. Next time you masturbate, try this. Don't turn on porn. Sit quietly. Breathe deeply. Feel your heartbeat. Feel your belly. Feel your hand on your body, like you're healing, not chasing. At first it might feel strange, but soon you'll realize this is no longer about release. It's about reconnection. About reminding yourself that even at 60 or 70 you're still a man, and your body still deserves to be touched with care. It's no longer about pleasure. It's how I hold on to the man inside me that's still alive. 4. Masturbation after 60 can be natural therapy. What many men don't know is this. Healthy masturbation at an older age can become a kind of natural therapy. No pills, no devices, just you and your breath. Clinical studies have shown that maintaining gentle sexual activity after 60 can reduce chronic stress, stabilize blood pressure, reduce feelings of loneliness, improve sleep quality, increase natural growth hormones, and even prolong life when combined with a healthy lifestyle. Elderly wisdom isn't about acting old. It's about moving slower, living deeper, and being more intentional, even with masturbation. Because in the end, healthy manhood is not about performance. It's about knowing, accepting, and protecting the man inside you. At any age, stopping or continuing was never the biggest question. What matters far more is how you treat your body after 60. With understanding, with respect, and with a little patience for the man still alive inside you. Masturbation doesn't need to be hidden like a shameful secret. And it doesn't need to be glorified as a form of release. It's simply a natural part of you, like breathing, like sleep. And you have every right to choose how to live with it in a way that feels peaceful and right for your body. Elderly wisdom doesn't come from avoiding sensitive topics. It comes from the courage to face them, to listen to what's quietly changing inside you. You may not be young anymore, but your manhood, the deep masculine part of you, never disappeared. It's still there, waiting for you to reconnect gently and honestly. Because here's something most men never talk about. When you stop touching yourself for long periods, when blood stops circulating to your genitals, when muscle isn't maintained, your penis can slowly shrink over time. And most men only realize it when it's too late. If something in today's message spoke to you, give yourself a few more minutes for the next video, where I'll speak openly and in detail about the truth no one wants to face, penile shrinkage in men over 60, and how to prevent it naturally. And now, if you've ever thought you were too old to touch yourself, give this video a chance. And if you're quietly struggling with the same questions, leave a comment below. You are not alone.